You're very welcome to this talk, and it is Saturday the 30th of January, nearly another month gone already, but thank you very much for coming back. It really feels good to communicate. I'm going to look at some things that have gone right and gone wrong today. We'll use the UK, the European area and the United States as examples, and we'll see how we get on. Much less quantitative today because it's a Saturday, so we'll have a few less numbers. Now, I want to start off with the origins of this pandemic, which are being hotly debated as we speak. Let's just have a look at this now. Now, the World Health Organization official investigating team are actually on the ground in Wuhan as we speak. So a 13-person team actually there now in Wuhan, but they're not saying a lot. They're not talking to the press at the moment, so quite how things are going we don't yet know. Let's hope the press conference when it comes is full, clear and explanatory, but at the moment we don't have a lot of information. But anyway, Dutch virologist who's in charge, or one of the senior guys, now remember, everyone in the team has been authorised by the Chinese authorities, and this has taken about a year to get off the ground. The delays have been bordering on the farcical if this wasn't so serious. I think we have to manage expectations. In other words, we're not going to give you any information in the next few weeks. If you look at some of the earlier quests for the origins of the outbreaks, they've taken years to complete, so it's not our fault. This is what you call expectation management, and I do find it rather pathetic. Why doesn't he say something like, well, we might not get there, but I expect to give you some facts? It's disappointing already. Now, Wuhan lab staff, first victims of coronavirus, ? Now, this is a report in various press outlets, but it does come from the US State Department. So this can't be readily dismissed. It's from the US State Department, and these guys have probably the world's best intelligence gathering services. Chinese virology lab. People were sick with a COVID-like illness in the autumn of 2019, according to this information from the US State Department released on the 16th of January. That they're saying they got it from undisclosed information. Now, there's two possibilities here. Either the State Department's lying or they're not. And it's not surprising that they can't disclose all the information that they get because they're the State Department. They have to have secrets. But the State Department's saying they've reason to believe that several researchers inside the Wuhan Institute of Virology became sick in the autumn of 2019 before the first identified cases in the market, with symptoms consistent with both COVID-19 and common seasonal illness. So did they just have a common illness or not? The State Department seems to think not. The lab had been carrying out research on bat coronaviruses, we know that's true. The CCP, Chinese Communist Party, has prevented independent journalists, investigators and global health authorities from interviewing researchers at the Wuhan Institute of Virology. That is not me saying that. That is from the report from the US State Department. So quite serious suggestions there, really. Now, the Chinese authorities have been saying that the virus was a US military biological weapon. So certain aspects of the Chinese authorities have been saying that this was concocted by the American military. Presumably the American military then smuggled the virus into China, started the outbreak in China to make it look like it was from China when it was actually from the US military. This really, of course, is in the tin hat brigade level of thinking. It's absolute nonsense. But having said that, until we get the evidence from the US State Department, we're not really any further forward, really. But that's what the US State Department is saying. So that is interesting. I think we can say it's interesting. Now, this is not to say that this virus was bioengineered in a lab. It wasn't. All the world's, several of the world's intelligence services have looked at this and they've decided it's not. It is a spillover zoonotic virus. The question is, was it a virus that was being studied by the Wuhan Institute of Virology and escaped? Or did members of staff corruptly remove animals from the Institute of Virology to sell? We don't know. So no suggestion this is a biological weapon because Oops, sorry, that's Robert. Robert, we're coming on to you later. Thank you for sending your video in. but that'll be for later. Now, if you've got to bear in mind that government labs that work on biological warfare are quite capable of making a virus that would completely wipe us out, probably with a 90% fatality rate or something in all of humanity. So they are capable of doing this. So there's no suggestion that this is such a virus, none whatsoever. But it is frightening to realise that viral warfare is an existential threat to humanity. But this is not what that's about. We're talking about a zoonotic virus. The question is, how did it get out? Mr. Fu, director of China's Centres for Disease and Control, talking to state media, the coronavirus wasn't found in any animal samples at the seafood market in Wuhan, ground zero of the pandemic. So it's starting to look like this seafood market, that's a bit of a euphemism really. These markets are, by Western standards, appalling places where animals are kept and slaughtered on site in appalling conditions. But no evidence from Mr. Fu there that is where this virus came from. So will we ever find out? I'll leave you to answer that one. Now, December last year, December 2020. There was a team from the BBC in my country, and they were visiting the Wuhan area to investigate a mystery illness. Now, the story here was that 3 miners in 2012 had an illness which was basically the same as SARS-1 or SARS coronavirus 2. The illness appeared to be the same. And they had been working in areas where there were bats. So the BBC team was on the way to visit this. It killed 3 mine workers in 2012. Presumably, actually, many more people were infected than that. It killed 3. Apparently, they were followed by vehicles on the way. And just as they were about to get to the cave system where they were going to investigate this, unfortunately, there was a lorry which had broken down in the middle of the road and they couldn't get there. So, shucks, such bad luck, isn't it? You know, they'd gone all the way, lorry had broken down in the road, couldn't get through to the cave system. It's a jungle site, quite difficult to get to, and it's an area of major coronavirus research. So, pity about that broken down lorry, wasn't it? Now, still talking about vaguely political things. Monsieur Macron. Apologies, sir, for the appalling French pronunciation. Anyway, Emmanuel Macron, President of France, of course. Now, this surprises me that someone in his position would be talking about this sort of thing. But he is. He said the AstraZeneca vaccine is quasi-ineffective in over 65s. Now, quasi-ineffective, what the heck does that mean? Basically, he's saying that it probably doesn't... Well, what is he saying? You know, weasel political words. But basically, he's casting aspersions on the efficacy of the AstraZeneca Oxford vaccine in the over 65s. And likewise, that's a Deutsche Welle report, check it out. Likewise, in Germany, the Vaccine Commission, the STIKO, is the Vaccine Commission in Germany. Oxford AstraZeneca vaccine only going to be given to people under the age of 64 and under. Why? There is currently insufficient data to assess the efficacy of the vaccine for persons aged 65 and older. Now, this has caused a lot of trouble and anxiety this week. So I've talked to people in England, round about me, whose parents have been vaccinated recently, maybe parents in their 80s, and they're saying, well, what does this mean? Does this mean they're not covered at all? You know, it really is quite bizarre that this sort of... I see this as disinformation, but coming from government sources. You know, we've got enough disinformation it is from the conspiracy theorists. Anyway, so what we try and do is go back to the evidence. So what is the evidence saying in relation to Mr. Macron's concerns, shall we say, and the German decision? Lancet, 18th of November, we reported on it at the time. Phase 2B clinical trial, I guess this was. In participants who received 2 doses of the vaccine, this is the Oxford AstraZeneca vaccine, median anti-spike SARS coronavirus 2 immunoglobulin G response 28 days after the booster dose were similar across 3 age cohorts. So similar immunoglobulin type response across 3 age cohorts. So this is what the paper is saying. Now, what were those age cohorts? Well, these were those age cohorts. 39 in the 18 to 55, 26 in the 56 to 69-year-old age group, and 47 over the age of 70. So in those three age cohorts, the immunological response was similar in all groups. So when we go back and actually look at the evidence that we have, which is all we can do, we see inconsistencies between the evidence and Mr. Macron's concern and the German ruling on this matter. It doesn't appear to be evidence-based from the evidence I have. And, this is the paper. Don't take my word for it. Check it out. It's in the Lancet. It's peer-reviewed. This is proper science here. And it's inconsistent with what these people are saying as I perceive what they are saying and as I perceive the article. By day 14, after the booster dose, 208, over 99% of the 209 boosted participants, that's the ones that had 2 injections, had neutralising antibody responses, and T-cell responses peaked at 14 days after a single standard dose of vaccine. And of course, this is one of the big rationales for why we're giving the 1 dose in the UK, because you get a good T-cell response 2 weeks after the first injection. And I haven't checked it this time, but from what I remember, the T-cell response was not actually increased by the second dose. Now, we still need the second dose, of course, but it seems to be this T-cell response that is protecting people from getting sick and being hospitalised. So, rather surprising there from the President of France and the German Vaccine Committee. I don't see it as being consistent with the evidence. Professor John Bell, who knows probably more about this than anyone else in the whole wide world, Oxford vaccine team, well, he's one of 3 or 4 in the Oxford vaccine team that know more about this than anyone. He's an elite member of this team. I'm not sure where Mr. Macron got that from. Other studies proved elderly people responded just as well as other age groups. There's really persuasive evidence that this is a protective vaccine in those populations. So it looks like Professor John Bell, one of the lead members of the vaccine team in Oxford, disagrees with the German decision and disagrees with Mr. Macron's concerns. Now, yeah, it's an inconsistency, isn't it? It just surprises me that it surprises me. And if we go back to the evidence and compare it to the evidence, but of course most people don't go back to the evidence, this is the problem. Even the European Medicines Agency has recommended the AstraZeneca vaccine for all adults as of yesterday. All adults, which is correct based on the data. Safe and effective at preventing COVID-19 in people from people aged 18 years of age and upwards. That's what it's saying. Now, if you live on this side of the pond, you can't help but have heard about the disgraceful behaviour, really. I think from the European Commission. Anyway, let's look at it. European Medicines Agency authorised the Pfizer vaccine on the 21st of that's right. The European Medicines Agency, authorised the Pfizer vaccine on the 21st of December. The Medicines Healthcare Regulatory Authority in the UK had already authorised it on the 2nd. So we see the delay there is 19 days delay there. So they're a bit slow off the mark on that one. That was a bit slow. Got there eventually though, so that's good. The Pfizer's being rolled out in Europe. Right, a European Medicines Agency authorised the Oxford AstraZeneca vaccine on the 29th of January, whereas the Healthcare Medicines and Regulatory Authority in the UK authorised it on the 30th of December. What on earth caused this delay? Now, we were bouncing up and down about this on this channel, saying, why don't they get on with it? And we said they'd approve it, and they did approve it. But it took all that time. Why did it take so long? Well, I actually looked at some old press cuttings on this, and I found out some information, and I checked this. I did a double take on it. It was really quite incredible. European Medicines Agency was closed from the 23rd of December to the 4th of January. Now, that is just... In the middle of a pandemic, the European Medicines Agency closed. The office is closed. What are they playing at? It's just unbelievable. Now, I'm sure employees were doing some homework, but the offices were closed during that time. Let me ask you this question. Do you think closing the offices would have speeded up their deliberations? Now, still on the European Commission, Pfizer vaccines being made in Belgium, being exported to the UK, the European Commission has given Belgium permission to block these exports. Now, this is absolutely incredibly serious. Now, this is the Pfizer-BioNTech vaccine. Now, the background here is that the European Commission basically have been slow on this all the way through. I mean, I remember back in, I think it was March, they were trying to buy PPE. And so they'd agree a contract on PPE and then they consult with all the 27 member states and they'd have to get back to them. And after a couple of weeks, they'd ended up buying 0 pieces of PPE. The individual member states had to buy their own PPE, but with a delay. So if you take the Pfizer-BioNTech vaccine, for example, BioNTech is a German company. It's a German setup doing world-class science. And they tried to get funding, as far as I understand this, from Europe and from Germany. They didn't get any, so they had to link up with Pfizer. So the European Commission weren't pump priming this with money, whereas the United States, Operation Warp Speed under the previous Trump administration, put, I believe, $10 billion into this. $10 billion into this. Whereas my understanding with the European Commission is they said, oh, well, you go off and make a vaccine, take the financial risk yourself, and we'll buy it if it works out. In the UK, we put tens of millions of pounds into this as well, and now they seem to be embarrassed by this and seem to be kind of lashing out all over the place at the moment. They want export transparency mechanisms. Well, we all want transparency, don't we? Let's hope that happens. Now, the UK is expecting 3.5 million doses in the next 3 weeks. It was ordered in May 2020. The European Commission purchasers finally got around to ordering this in August, May, June, July, August, 3 or 4 months later. Why hadn't they ordered it earlier? Did they not realise they were in a pandemic? It really is strange that they didn't seem to realise this and didn't order earlier, didn't pay for research or enough research. Raid on AstraZeneca site. Now, the AstraZeneca site was actually raided, apparently. I mean, it sounds like something out of the Second World War. It's unbelievable. It was raided by... now, I don't imagine people were throwing hand grenades around. It's not that kind of raid. But the Belgian authorities went in and I don't know what they did. Very irregular and very strange. Anyway, the US has been incredibly proactive. Now, I know a lot of people don't like the previous administration in the United States. I know a lot of people love the previous administration in the United States. All I'm saying now is they were very proactive on Operation Warp Speed and the vaccines. So the Moderna vaccine, the Pfizer vaccine, the Johnson & Johnson vaccine, the Janssen vaccine that we looked at yesterday, these are all coming out of Operation Warp Speed. And I can't remember the other one, the Novavax. I can't remember if that did or not. But this proactivity was marked in the United States and in the UK. So the UK at the moment has got access to 367 million doses. Pfizer-BioNTech, we've ordered 40 million. Oxford-AstraZeneca, 100 million. Moderna is 70 million. Pity none have arrived yet. They're arriving in March. Novavax, of course, which has just published very positive phase 3 data that we looked at yesterday, 60 million. It goes on. Janssen, Johnson & Johnson, we've ordered, of course, good results from that as well. So the Novavax, and the Johnson & Johnson, the Janssen. So Janssen is the pharmaceutical division of Johnson & Johnson, which is a much bigger company. These should be authorised. These two vaccines, I'm expecting to be authorised, the Novavax and the Janssen. I'm expecting these to be authorised in the UK within weeks. But I don't know when the supplies are going to come, but I suspect they're going to be authorised within weeks, which is encouraging. The GlaxoSmithKline Sanofi, the French-based vaccine, we ordered 60 million doses of that. Now, that one didn't work out It's gone back to phase 2, but we kind of bet on that horse. Okay, that one didn't win, but the other ones did. You have to be proactive in these things. And the UK is increasing manufacturing capacity. So Braintree, Essex, there's a huge plant. Vaccine Manufacturing and Innovation Centre in Oxfordshire also. And these are going to be coming online soon and are going to manufacture massive amounts of vaccine. And I believe that when the UK population is vaccinated, these plants will carry on at full production and we will be exporting huge amounts of vaccine around the world. I really believe that is going to happen. And if it doesn't, I'll be doing what I can to make sure it does happen. United States. Now, just a few things looking back in the States that haven't gone very well, really. And this is starting now. People are saying, just a minute, what happened way back then? So, this pandemic's unnecessary. It was covered up by the local authorities in China. It was the early part, in my view, was not well handled by the World Health Organization when they said carry on flying when they should have said we advise an embargo on all flights. We've been let down on both levels. But now people are starting to look at their own areas and areas where things could have been done a lot better. So, and of course, the problem is with this is the countries with the biggest openness are the ones where things are brought up. So, people are going to find out things in the US. People are going to find out things in the UK because we have relative openness. Other countries that we don't need to mention, we're never going to know. So we're not going to know whatever happened in, or for that matter, or even we're not going to find out what happened in, you put your names to those countries. We're never going to know. But anyway, the United States, late January into California, 200 Americans were evacuated from Wuhan. Health officials of the US Health Department didn't wear proper PPE because they said it wouldn't look good. Wow. Who took that decision? Why is he still in his job? The lack of accountability has been a common theme in this. Days later, not weeks later, days later, these officials boarded commercial airlines and flew to other parts of the country. And unfortunately, now in the United States, we have a pandemic. Do you think that these people flying around the country would have helped that situation? Nursing home deaths. And this is very, very, that's quite upsetting, this one, and unsavoury. New York State Attorney Letitia James is investigating this. The number of deaths in New York in nursing homes has gone up to nearly 13,000 and it may rise further yet. Quite a few things were systematically done wrong, like deaths didn't include people transferred to hospital. Attorney General James has said consistent discrepancies. Deaths in nursing homes and long-term care facilities, about a third of the deaths in the States, actually. Now, word is, I don't know, Mr. Como has done some sort of publication, I believe, on this. Has he published a memoir that is being sold? That can't be right, can it? So I don't know about that, but if it is, if he's selling memoirs, then that would be. Let's hope he's not. Let's hope he's not. Right. Let me know about that because we're not in the retrospective stage of this pandemic yet. We're still bang in the middle of it, and the numbers continue going down in the United States, which is remarkably reassuring. But they're going to start going up when the new variant becomes more prevalent. That's me speaking. I think that's going to happen. I hope I'm wrong. But unfortunately, I've been right about a few things in this pandemic that haven't panned out too well. Or panned out a bit late. So I'm concerned about the cases going up in the States. Good news. Oxford AstraZeneca vaccine in the US. Oxford AstraZeneca are ready to launch in the US as soon as they get FDA approval. Now, it's a bit disappointing. I was hoping that the FDA would give it authorization based on the phase 3 clinical trials, but they haven't. Because the states could certainly do with this additional vaccine. But the US arm of the trial is now fully recruited. I can't remember how many, but it was a big number. They're now waiting for enough people to get COVID. It probably won't be too long. And he says, I can't remember who that was, probably someone in AstraZeneca, this will happen in February. So Oxford AstraZeneca vaccine will be rolled out in the States, I believe, probably early March at a guess. Now, problems in New Zealand, in Auckland. Quarantined hotel worker had an inappropriate encounter with someone who was being quarantined. They were together in a room for 20 minutes. Now, some people might not think 20 minutes is a very impressive period of time, but it's more than enough to contract this virus. The idea that people in authority are abusing their power in this way is just inexcusable. Now, the individual concerned has been sacked, but they should be imprisoned for that. That is just quite... it's a betrayal of trust, isn't it? Really quite incredible. Right, let's listen to Robert. Now, there's some great heroes in this pandemic, and one set of great heroes is all of those that took part in vaccination trials. So we're going to listen to Robert from the States, and he's going to tell us about his experience. Pretty sure it is with the Moderna vaccine. So let's listen to Robert now, and I'll try and work out my microphones and get it right today.
Hey, John, I want to thank you for what you do and the information you put out on behalf of everyone watching in America. We really appreciate your all that work you're doing and the research you do and the information you put out on COVID. I just wanted to tell you, I'm a part of the Moderna COVID vaccine group. That's my card, my vaccination record card. I got my first dose, the Moderna vaccine, on August 10th of last year, and I got the second dose about 28 days later on September 8th. And I know millions of people have been vaccinated already, but I just thought I'd tell you how my experience was. On the first dose, August 10th, I got a shot. I didn't know if it was the placebo or the real thing. Nobody in the study knows. And I had some arm tenderness, like somebody punched me for a few days right here, but nothing else, no side effects. On the second dose, September 8th, I had that same, like somebody punched me in my arm, and I got the shot that morning at 10 a.m. And that night, I felt good after that throughout the day. That night I woke up with chills, like pretty good chills. Got under the blankets, went back to sleep, and I was under 2-3 blankets and kind of shaking. In the morning, I had a fever. It was 100.7 at 8 or 9 a.m. the following day. And throughout the day, I got better, and by the end of the day, I was almost at 100%. It was, I called the Moderna study people, talked to the doctors there and described my symptoms, and they said that was completely normal, or normal in some people. It felt a little bit like a small hangover, but overall I was happy with, obviously, the protection I'm getting for most variants, hopefully. I'm a hotel photographer. I travel around the U.S., sometimes the world, and get on airplanes weekly almost. So having this protection was good, but I just want to tell you about the experiences I had, and thanks. Hope it helps some people out there.
It's great, Robert. Thank you for that. Always good to hear people's individual experience. Now, have I got that off and I got my microphone on again? That's it. Good. So confusing. Now, Robert, there he had the Moderna shot. First shot, bit of a sore arm, probably a bit of inflammatory reaction in the arm as the antigen started working. But then what would happen then? He would make the antibodies to it. So when he was given the second dose, he was already immunologically reacting to the antigen because it already mounted an immune response. And the chills, we call those rigors, that's the body temperature going up. That's what gives you the fever. And it's my understanding and belief that the fever is part of the immunological response. It's helping the immune response. So if people can avoid bringing their temperature down with acetaminophen, paracetamol, ibuprofen during that period of time, if they can avoid that, then I believe that will enhance the immune response. I think there is evidence for that. So really appreciate people sending in their own experiences like that. Thank you, Robert. Appreciate you sharing that. But if you think about it, okay, you felt bad for a few hours there after the second dose. But of course, now he's immune. It's a price worth paying. I'm sure he'd feel much worse if he actually had the disease. Now, this is a slight problem with these clinical trials, really, because, I mean, it sounds really obvious there that unless what Robert was experiencing was entirely what we call a nocebo effect, it seems very likely that he actually had the vaccine in that case. So hopefully he's got immunity, and that's great, and that's by taking part in the trial. Of course, 50% of people will just get the placebo. So hopefully they'll be unblinded soon, so that the people can vaccinate if it did turn out they were in the placebo group. Now, just a couple of emails before we finish today. ER. I had my vaccination today. No ventilation at all in the vaccination centre. Just incredible, isn't it? You go to a professional centre to get vaccinated and it's not ventilated. Now, this is Gabe who said this, and this is a pretty poignant point, really. With the very nature of RNA viruses and the populace of Africa with a very large amount of HIV positive sufferers, SARS coronavirus 2 is going to linger in the immunosuppressed for longer periods of time. This will mean Africa is a perfect breeding ground for new variants of COVID-19. Extra effort should be made to extinguish the virus from Africa ASAP, absolutely. Until this occurs, we should ban travel to and from Africa until further notice. This is my warning and opinion only, says Gabe. Well worth thinking about, though. You know, there's sort of three ways that the virus the new variants develop, really. So far, the main evolutionary driving pressure has been increased transmissibility. So, like the UK variant is more transmissible, so it outcompetes the old variant. So that is one way one evolutionary pressure on the virus. More virus can survive if it's more transmissible. The second way is in people that are immunosuppressed. If the virus is in them for longer, the virus is reproducing more often. The more times the virus reproduces, the more likely there is to be a mutation. That's the second way. And the third way will become more of a problem as more people become immune. Because as more people become immune, the only viruses that will survive are those which can affect the immune people. Therefore, they'll be the viruses which reproduce. The viruses which are killed by the immunity that's given by vaccines or by herd immunity won't reproduce. So the increasing amount of people in the community that are immune is actually going to be of an evolutionary pressure for the virus, because it'll be different variants of the virus which can evade this immunity, whether it's natural or vaccination caused immunity. They'll be the varieties of the virus which reproduce. So that's the third evolutionary pressure for change, and that will become more of a problem as more people become immune. So that's the three main evolutionary driving forces: increased transmission, which we've seen so far; people with immunosuppression of the virus for longer, which is going to be a problem, and as Gabe says there, HIV is such an issue; and evolutionary pressure from people that are immune, which is going to be a bigger problem in the future. That's why ideally you would treat everyone in the world all at the same time. So if you treat everyone in the world all at the same time, you don't have the chronic infections. You basically take away all of these evolutionary pressures, because you're clobbering everything all at the same time. But unfortunately, that is not practical to do. So there will be more mutants that we need to take account of as this pandemic starts to wind down. Dramatic wind down in the next months. Gradual wind down, I believe, over the next few seasons, and I am still optimistic that SARS coronavirus 2 can be eradicated, but it's going to take a lot of international effort. And although it's going to get a lot better for us in Western countries when the vaccine programs do kick in. Ultimately, we need to eradicate the virus everywhere, because to eliminate this pandemic, we'll have to immunise basically everyone in the world up to, or every country in the world up to herd immunity levels. So that's going to be a challenge for the world over the next few years. Do you think the world is up to this challenge? Okay, of course, thank you for watching. Actually, feels good to. I like communicating like this. It's good. The preparation can be a bit tedious, but the communication is good. So, thank you for watching.